Fair Use Act Disclaimer.
Yeah, it's Moana, baby.
Hi kapatids, my name is Resh and I'll be your guide for today's episode of 30 for 35. In this video, it will be about the hamstrings, gastrocnemius, plantaris, and popliteus muscles. The hamstring muscles are located at the posterior fascial compartment of the thigh. It consists of biceps femoris, semimembranosus, semitendinosus, and the hamstring portion of the adductor magnus muscle. The gastrocnemius, plantaris, and popliteus muscles are found at the posterior fascial compartment of the leg. Disclaimer: the references used are the Snell's Clinical Anatomy by Regents 9th edition and the Netter's Atlas of Human Anatomy 7th edition for the pictures and illustrations. Let's get started. Ano ha? Papalag ka ba ha? Papalag ka ha? Papalag ka? Ano ha? Ha? Kanto mo? Kanto mo? Ha? Kanto mo? We will be discussing first the different bony landmarks of the issue, femur, tibia, fibula, and tarsal bones that serves as the points of origin and insertion of these muscles. In the issue, which is one of the pelvic bones, we will be discussing only one landmark, which is the ischial tuberosity. The ischial tuberosity is a roughened and thickened structure that serves as the common origin point of the hamstring muscles except for the short head of the biceps femoris muscle. In the femur, we will be discussing four landmarks: the linea aspera, lateral supracondylar ridge, adductor tubercle, and the condyles of the femur. The linea aspera is a ridge located at the posterior shaft of the femur. The lateral supracondylar ridge is located below the lateral margin, which is created by the separation of the two margins of the linea aspera. These two sides are the origin points of the short head of the biceps femoris muscle, while the plantaris only originates from the lateral supracondylar ridge. The adductor tubercle is located at the medial condyle of the femur. This serves as the insertion point of the adductor magnus muscle. The medial and lateral condyle of the femur is located at the lower end of the femur. This serves as the origin point of the gastrocnemius muscle, in which the lateral head attaches to the lateral condyle while the medial head attaches to the medial condyle. The popliteus muscle originates from the lateral surface of the lateral condyle of the femur. The head of the fibula is located at the upper end of the fibula. This serves as the insertion point of the biceps femoris muscle. In the tibia, we have the shaft and the two condyles. The shaft of the tibia is a long slender bone that has four borders and surfaces. It serves as the insertion point of the semitendinosus muscle, specifically at the upper part of its medial surface. The posterior surface of the shaft above the soleal line is where the popliteus muscle inserts. At the upper end of the tibia, we have the medial and lateral condyles. These condyles articulate with the medial and lateral condyles of the femur along with the patella to form the knee joint. The medial condyle serves as the insertion point of the semimembranosus muscle at its posterior aspect. The calcaneus, one of the tarsal bones, is the largest bone of the foot and creates the prominence of the heel. The posterior surface of this structure is where the gastrocnemius inserts via the tendocalcaneae or the Achilles tendon. It is also where the plantaris muscle inserts. We already have tackled the origin and insertions. Now, we will be discussing the innervation and the actions of these muscles. The hamstrings muscles are supplied by the sciatic nerve. the sciatic nerve is divided into two portions in accordance with its branches. The tibial portion, which will form the tibial nerve, supplies the hamstring muscles except for the short head of the biceps femoris, which is supplied by the common peroneal portion of the sciatic nerve. The common peroneal portion of the sciatic nerve will then form the common peroneal nerve. The tibial nerve innervates the gastrocnemius, plantaris, and also the popliteus muscles. When it comes to the actions of these muscles, we'll be discussing 4: hip extension, knee flexion, knee lateral rotation, and knee medial rotation. The common actions of the hamstrings are knee flexion and hip extension. But when it comes to the biceps femoris, the long head of the biceps femoris is the only one that participates to the hip extension. The gastrocnemius, plantaris, and the popliteus muscles are only participating to the knee flexion. The knee medial rotators are the semi-muscles, while the biceps femoris only participates to lateral rotation when it comes to the hamstrings. The popliteus muscle unlocks the knee joint during the movement of lateral rotation of femur on tibia in order to slacken the ligaments of the joint. The only muscle that does not participate in knee flexion is the hamstring portion of the adductor magnus muscle. It only participates during hip extension. These are the tips to remember. The first tip to remember is that the quadriceps muscles are located at the anterior fascial compartment of the thigh, while the hamstring muscles are located at the posterior fascial compartment of the thigh. The positioning of these muscles can also influence the actions. For example, if you kick anteriorly with your legs straight, you will perform the actions of the quadriceps muscles, in which you will demonstrate hip flexion and knee extension. If you kick posteriorly with your legs bent, you will demonstrate the actions of the hamstring muscles, in which you will perform hip extension and knee flexion. The second tip to remember is to associate the insertion to the innervation. For example, the semitendinosus and the semimembranosus inserts at the tibia. So it will help you rule out that the innervation of these muscles are the tibial portion of the sciatic nerve. The third tip to remember is that the posterior fascial compartment of the thigh is being innervated by the sciatic nerve, while the anterior fascial compartment of the thigh is being innervated by the femoral nerve. The fourth tip is to remember the abbreviation BF-CTSM, which means best friends niya ay 10, so marami. The abbreviation BF-CTSM can help you remember the hamstring muscles. The word best friends indicates biceps femoris, while the phrases sis ay 10 and so marami indicates the semitendinosus and semimembranosus respectively. The last tip to remember is to relate the action to the attachment of the muscle. For example, the reason why the gastrocnemius, plantaris, and the popliteus muscle does not participate to hip extension is because they only attach to the distal end of the femur, whereas the adductor magnus does not participate to knee flexion because it only attaches to the femur and not to the tibia and fibula. So that's it for our discussion about the posterior fascial compartment of the thigh and the leg. I hope that you have learned a lot of things today. Don't forget to like and share this video and support our partners. Tada! Daming partners na. Always remember that my name is Resh and we're done for today's sesh.
You with an intent that glued me to the floor. You're beautiful, so gorgeous and alone. Honey, all I want is to hear that sweet tone when you say my name. Say it loud, no way to whisper now. Say my name. Oh. what it is I want you to do. So